Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Welcome, everybody. We're excited to have all of you here with us today. So we will get started. I am going to hand it over to Dr. Cy Huffman from BlueCare, Blue Cross Blue Shield of Tennessee, for our introductions to start out our programming today as we talk through FAQs and billing for some population health coding for health coaches.
Thank you, Ashley. Everyone hear me okay? Great. It might be good to do some brief intros, and maybe I'll introduce myself and maybe the UTHSC team and others, and we'll figure it out. So I'm Cy Huffman. I'm the Chief Population Health Officer for BlueCare Tennessee, Medicaid Managed Care. And so I'll give you a little history while I'm doing this, introducing myself. You may have seen a communication listing me as Chief Medical Officer. I'm not. We've been at this work for about 3 years together. All three Medicaid MCOs, lots of stakeholders, through both a population health subcommittee, which I have chaired the whole way. Half that time I was the interim chief medical officer, so there's a lot of confusion there. So I had a job, had an extra interim job, and now I'm back to my old job. So it's been really good work. It's taken us some time to get to this point. We're glad to be where we are. We still have more work to go, but with our pop-out subcommittee. So, we have 10 care representatives. We have multiple practice stakeholders, the Tennessee Primary Care Association, lots of stakeholders have been engaged and worked hard together. So glad to be at this point today. We're going to share some things. So that's probably enough of an intro from me. Try not to talk too long, but Ashley, just introduce yourself and your role, and then just call on my other friends at UTHSC and go from there. How about that?
Yeah, thank you for that, Dr. Huffman. So my name is Ashley Ellis. I am a pharmacist, and I'm housed mostly in the College of Pharmacy. I'm Assistant Dean for Strategic Partnerships and Innovation, and my role on the Population Health Consortium is the Director for Practice Implementation. So I really help practices to implement pharmacists within their business model, or health coaches, or whatever they need in order to achieve their population health goals. So that's really my role. And then this year on our CDC grant, I'm really helping to lead the learning collaborative efforts.
And I'll go next. I'm Susan Butterworth,
Yeah.
and I am the associate professor there at UT, and on the consortium, I'm the director of patient engagement, and I do a lot of work with the health coach training and certification.
I'm not looking at the whole Hollywood squares. I know Brandy, you're probably there. Brandy Bledsoe.
Yes, good afternoon, everyone. My name is Brandy Bledsoe. I'm the Senior Program Coordinator for the Tennessee Population Health Consortium, and I assist with the coordination of the Learning Collaboratives. So welcome.
Thank you, Brandy. Who else is on from UTHSC? Is it just the...
I'll just mention Dr. Jennifer Ride with I'm actually with QSource, and I'll be continuing to work with the education and learning collaborative work group. So, but we have stepped back from that, and so I just am attending and look forward to hearing what you have to say. Thank you.
Well, really glad you're on, Jennifer. Jennifer and I go way back. I used to be on the QSource board until 11 years ago. I had to resign because conflict of interest with working for a Medicaid MCO, but had a lot of great times with QSource, and value all those long-term relationships. Okay, what about practice participants, others? Just introduce yourself.
I'll go. I'm Tawanda Murray. I'm a new health coach. I'm very feel entitled to say something to Miss Butterworth. She's walked me through all of this for quite some time, as well as being a CHW. So I'm here to learn some coding and billing because I run a recovery business as well. So doing different things, just looking forward for some informative information. Thank you for letting me share.
Well, I'm glad you're here today. That's fantastic. Probably learn more from you than people learn from me, but yeah, okay.
My name is Amber Grantham. I am a pharmacist in Jackson, Tennessee, and I'm working on my CDCES currently.
Hi, Amber.
Hello, how are you?
Hi, I'm Jennifer Logan. I'm with ETSU Health. And we also have Carolyn Bailey on the call, who also works in the population health department with me.
That's great. Glad you're on from ETSU Health. You have a very fine organization I'm working with on some other topics currently. Did we miss anyone? Okay, well, just a few more introductory remarks from me. So the big idea is really team-based care, and with health coaches as part of that team, and we all believe that there can be some great improvement in people's lives, the people served, patients to the practices, and members to the MCOs, and beneficiaries, I guess, of TennCare. So I do want to state that, we're focused on primarily on Medicaid in this discussion today. It has application more broadly than that, but some things may pop up as we go through the presentation about that. But I said we got to a very good point. Dr. Ellis and I, or many of some other people, we're going to sort of later, you'll see in the FAQs about pharmacists and stuff, so we'll talk about that a little bit. So I think, in order not to prolong all my introductory comments, I think, Ashley, Dr. Ellis, I'll turn it over to you.
You're on mute, Ashley.
Sorry. So sorry. I thought we would have gotten there by 2020, right? Brandy, would you mind sharing the FAQs? I mean, the service codes document. The list of codes. Yeah, that's it. Okay, so what we're going to be going through today, you will be able to find all of this on our tnhearthealth.org website. So that's one of the really great things about our website, is that we try to put all of this information available for you at your fingertips. We want to make sure that you are able to use it and access it, that you're able to provide it to your billing, coding, compliance, anybody that you need to that needs to know about what we're doing. So we have here a list of codes, and I also want to thank Dr. Huffman here for leading our population health subcommittee. We've been working on this list of codes for about 3 years now, and really advancing team-based care, health coaches, and thank you, Brandy. So she's dropped the link directly to this in the chat. So if you'd like to bookmark that or star that in your browser, that's amazing, or just go ahead and pull that up and look at it for yourself. But this list of codes are primarily preventative and things that health coaches can do on the educational side. So we can kind of just go through these one by one. So at the beginning here, we've got intensive behavioral therapy for cardiovascular disease. You might see that. Thank you so much for zooming in. IBT is another way you might see that referred to in the literature. So this is G0446. It's 15 minutes of face-to-face care where a health coach can provide education to a patient about prevention of CVD complications. So that could be anybody who has any kind, let's say they're taking one medication for hypertension, or you want to go through their labs with them and talk about preventative things like taking aspirin, exercise, eating a healthy diet, low sodium diet. Those are the kind of things that you can talk about in the IBT for cardiovascular disease. And it really goes through here specifically with your billing department, if it receives bundling, if it pays, if billed with an office visit, or if it needs to be billed separately, and if it requires modifiers and those type of things. So this code can be billed as telehealth. So all of those are over in the comments. So if you have questions about that, keep that in mind. The second code that we have here is, and let me just say on cardiovascular disease, that's a 1 time per year code for those that qualify. The IBT for obesity is G0447. This is a code, back when I first started working in primary care, I would really say this code was kind of like my bread and butter type code, because patients who qualify for this one, you have 22 sessions that you can use over a 12-month period, and that's your calendar year. So it restarts in January if the patient does not achieve the weight loss and get their BMI below 30. So you can think about a lot of patients would qualify there. So you have one face-to-face visit every week for the first month, and then a face-to-face visit every other week for months 2 through 6. And then months 7 through 12, we need to make sure that they've lost at least 6.6 pounds there. You can work with your medical team if appropriate for weight loss medications. In general, when I've done this before in the past, I have really focused on lifestyle modification. But if your medical team feels that's appropriate, you can as well. So that's 22 visits. And, you know, if you think about like the smoking cessation, which we'll talk about in a minute, not all patients achieve their weight loss goals, or they may lose some weight and then have something where they gain it back. That resets in the following year. The next code is smoking and tobacco cessation. There's 2 codes there. So one is for 3 to 10 minutes and one is for greater than 10 minutes. So you could use a combination of these. So probably that first visit, the way I have used these in the past is it's a longer conversation where you're talking about the smoking history, what they've tried before, who all is in their life that can support them and things like that. And then your other visits might be the shorter visits where you're checking in and seeing how things are going. It is important that the patient is a tobacco user at the time of billing. So keep those things in mind. And any type of tobacco could count. So that could be chewing tobacco, vaping, smoking cigarettes, etc. And then you can scroll over in the comments if you like and see about it's also eligible for telehealth. Okay, we can scroll down, Brandy. Thank you. All right, so counseling and risk factor reduction intervention. So these are really just timed codes. So we've got 15 minutes, 30 minutes, 45 minutes, and 60 minutes. So we can use those for interpretation or of something they got back. Maybe it's a screening, or maybe it's something that we need to provide more education for: smoking cessation, weight management, blood pressure counseling. And, you know, here at the Tennessee Heart Health Network, we really are trying to prevent heart attack and stroke. So you might be spending some time talking with them about their blood glucose, etc. So all of those are, if it's outside of these other kind of more restrictive codes. So kind of keep that in mind as you're thinking about those 99401 all the way through 05. Oh, sorry, 04. All right. As we kind of scroll down, those kind of require some supervision within the physician. Oh, can you scroll right back up to that diabetes? Okay, so diabetes self-management education. That's G0108 and G0109. So the 108 is a one-on-one and individual service for 30 minutes. And that can be broken up. So you could do 30 minutes one time and 30 minutes a different time. Or if you did 1 hour, you could build 2 of those together. And then the G0109 is, they are still billed in 30-minute increments, but that's group classes. So it is defined in groups of 2 to 20 is kind of how that works. If you're teaching groups with Medicare patients, for instance, they do require an accreditation through ADA or AADE. If you have questions about that accreditation process, please feel free to reach out and ask about that. We have been through that several times. I've been through that a few times myself, and it's a lot of paperwork, but it's definitely something that's doable to help support that business model. And the next code is the Diabetes Prevention Program. This code is another great code for health coaches to become involved in. It is more, whereas diabetes self-management education, the patient is required to have a diagnosis of diabetes. Diabetes prevention program, the patient needs to have there's several ways they can qualify. They could have had gestational diabetes. They need to have an elevated blood glucose or an A1C that qualifies them as prediabetes. But the curriculum is very defined, and it comes from the CDC. And it really focuses on weight loss and how many minutes of exercise that the patient is engaging in per week. So we have all of these different codes here listed out for you, but if you go down there to the weight loss performance piece, there is an incentivizing of if the patient has lost 5% of their body weight or 9% of their body weight. And so you can be paid extra if the patient achieves that, if they stick with the program. And then the last one is administration or interpretation of a health risk assessment. That is pretty broad. It could be any kind of, I'm sorry, that's not the last one. Any kind of tool, like let's say they got an A1C, or let's say they got some blood pressure readings, and you want to talk through those and what those mean over time. That would be a great time to use that code. And you can scroll down a little bit further. And we have chronic care management and remote patient monitoring. So some of the good things about these, I really like these codes. These are time-based codes for chronic care management, is that they're very flexible. With chronic care management, it does not mean that the 20 minutes you are engaged with the patient for 20 straight minutes. It's 20 minutes of clinical work or coordination of work. So you may be on the phone with them for 10 minutes and we need to figure out if they need to see their specialist, or maybe they need some medical equipment in their home, or work on a prior authorization for them. All of those things go into the 20 minutes of time, and then you can see complex time up to 60 minutes and go from there. And then remote patient monitoring does require the use of a device, an FDA cleared device, and that's also left open, but that can be anything from a blood pressure cuff, a glucometer, a scale if the person had heart failure. There's all different types of devices. If you are interested in participating with an RPM program, but you're unsure how to get that off the ground with the device part of it, we do have partners, which we have introduced to our group before, which are really great, because we've already got a data feed to our partnered clinics that can kind of help you get that off the ground really quickly, and then start helping to make those interventions and improve the quality side. So I'm going to stop there and see if we have any questions about the service codes.
I have one on the administration and interpretation of health risk assessment. When you scroll over, that says it's an invalid procedure code, and it was termed in 2016.
That's correct.
So we can't use that one for anything?
That is the combined feedback from all 3 MCOs on that particular one. We could do a little more exploration about, how does the absence of that billable code now affect what you're trying to accomplish?
I was
with the
just,
program.
yeah, I just wanted to clarify that. And then on the diabetes self-management education, it says Medicare requires ADA or AADE accreditation. What about TennCare?
We do
Any
not.
idea? Pardon me?
Medicaid, we made the decision, I believe, Ashley, you keep me straight here. I don't think it's required for the Medicaid recipients.
That's correct.
Yep.
Great. Okay, thank you.
Any other questions?
I think you're already hearing, the UTHSC team is ready to respond to your questions. We're all in this together, from the MTO perspective. So if you do have, and we're gonna have some FAQs I'll go through here shortly, but you may have others. And when we get to the FAQ section, I'm gonna make a couple of comments, but sounds like we're pretty good on this, Ashley. I think we're gonna have Susan, Brandy, is gonna share Susan's slide, and Susan's gonna talk a little bit.
Sure.
Thanks.
I do
Dr.
have one
Huffman.
question.
Sure, go ahead.
So I'm just getting started with these things. I am currently doing diabetes education in a primary care clinic, but it's owned by a rather large health corporation in Jackson, Tennessee. So how do I go about approaching them with, now I can bill for these services, and what does that look like? What does that look like through, is that through, and I'm really naive at this, does that go through administration to ask, or just really, how do I get the ball rolling with that?
Well, I would say this, I don't know if you're free to name the organization. It might be helpful. You don't have to, but from a process standpoint, each of the Medicaid MCOs has a requirement for TennCare to have provider network managers available to all practices. So we'll figure out how to make the connection, but I guess that's sort of an internal question inside your organization. I'm not sure how to answer that, but we would be prepared to, provide assistance, either through, the UTHSC staff or MCO provider network representatives. We could help you with it, I think.
I appreciate that, and I look forward to that conversation. Thank you.
Yeah, you may just, I don't know how we want to receive these things to the UTHSC team, but just maybe email it in or something. What do you think, Ashley?
Yeah, I think that would be great. And Amber and I do know each other through the primary care certificate program. So Amber, please feel free to reach out and we can set up some introductions on that side.
Thank you very much. I appreciate it.
And this is Susan. I'll just add that I think a good place to start is sharing these materials that we've shared with you today with your supervisor and or your leadership team. I think that's a great place to start the discussion. And then again, as Dr. Huffman said, like there are resources, external resources that can assist your organization.
Yeah, I think what Dr. Butterworth is saying is very helpful. Like when I first started, I didn't have anything specifically outlined like this, but I got a lot of, we can't do that. And then I think one of the helpful responses or the things that helped me is that like we can't do it or we've never done it before. And because it's new, and I understand that, but because it's new, it can make people a little nervous. But what we've tried to do here, and I'll let Dr. Huffman talk about this a little bit more, is we have tested the claims. They are billable and they will be paid. So hopefully no one's going to be spinning their wheels or just experimenting here. you will be paid for these services.
Yeah, you can, once we get to the FAQs document, which of course is on the website, you're going to be looking at it from the website. That's one of the FAQs, and it's one of the critical factors early on in our work for the 3 MCOs. Our role was, hey, let's make sure that if a provider starts billing these services, they're not going to run into problems, right? So I am far from a coding expert. That's why I kind of asked Ashley to do this, because she can explain the codes better than I can. But I've been in the middle of it, working with people inside our organization, operations, network, claims, all kinds of people. And, we tested everything with like some people. There's a very low volume of these codes being billed across Tennessee for Medicaid recipients in general. We verified that with the other two, United Healthcare and WellPoint. So we're not seeing a lot of these codes being billed, but we actually, and I think the other two did the same thing, but we actually have ways to test, like do dummy claims and make sure, yeah, it goes through. So we've done all that. We got a kind of a sandbox type thing we use just to double check ourselves. So that would be really helpful. You're right, Ashley, to share that, including the FAQs, because there's a fundamental issue there. If you run into problems when you try to build these claims, then that's a real problem, right? That's a showstopper. We don't want that to happen. But, and this is in the FAQs too, sort of a statement. If you do experience something like that from any of the 3 MCOs, we all have to kind of let the practice know, one form or fashion, communicate who your provider network representative is from each MCO. TennCare requires that. We just got audited by this QSource organization about all that this week. So yeah, I mean, so we know people are available to answer the questions as they pop up. So I don't know if that helps. I'm just kind of doubling down on that concept that, if anybody runs into problems, there's a way to get those problems worked out. We don't want to have any, but if we do, we have a fail-safe mechanism. If you run into this is kind of what to do.
So we have a question from Dr. Matt Gouge that I'm going to send this over to you, Dr. Huffman, but it says, do you have an average reimbursement rate for these codes?
I do not in my mind, but it's a great question. We can develop that, and they will not be necessarily standard across the 3 MCOs. So we need to kind of take that back to everybody. But it's a great question. It's an important one. Yeah.
I will say, Matt, if you, it is public, the Medicare reimbursement, if you look at the Tennessee physician fee schedule, if you want just a ballpark, I'm happy to put that link in the chat, and that can give you like I said, a ballpark.
So Brandy, if you want to pull up my slide, and everyone feel free to keep asking questions either through the chat and or as we go along, because that's, what we're here for, is to make sure that we're meeting your needs. We did feel that it was important in the state of Tennessee that we had standards for training and certification. And right now, what we determined is that there is no, it's different state by state. There are some national standards, however, by the National Board for Health and Wellness Coaching. I'm very familiar with this organization. I have presented for them. I have worked with them. They have a very comprehensive set of competencies, and their website is below if you want to go check them out, or I'll put them in the chat if they're not below. And essentially what I can say is that their competencies cover coaching structure, which would be, engaging, focusing, evoking, planning, or goal setting, coaching process. So this is how to build rapport and the coaching relationship, communication techniques, especially those that emphasize motivational interviewing. There needs to be wellness and health topics that include chronic disease and lifestyle management. As a health coach, we are not going to act in a clinical function, but we do need to be aware of when we refer people, when it's, to refer people back to the clinical team, and also to work with them on lifestyle management and chronic condition management practices. We need to be familiar with that. There are ethical and legal issues for health coaches. And so we require that an organization that's applying for approval, that their competencies are congruent. They don't have to be exactly, but they should match and cover these areas. We also felt strongly that the organization that is providing training and certification has a competency assessment that includes a practical demonstration of skill set. That means not just a true false or a multiple choice test, but an actual demonstration of a skill set using standardized patients. And this ensures that we have, a level of competence that's going to meet at least client-centered, and also eventually perhaps proficiency. So this is set up to ensure that it's good, I think, for health coaches, because it allows you to be very clear about what you need to do to work for a clinic and receive these billings. Right now, we have 3 programs approved in Tennessee. This is not going to be a static list. But right now, our UT program, and last week we had a webinar, and it is going to be posted on our website. It will tell you a lot more about our particular program. Vanderbilt Health Coaching Program is a very comprehensive program. And then the Coalition for Better Health, they have training for preventative health specialists. However, right now they work with organizations rather than individuals. But both of the first 2 will also work with just individuals. I will say at our UT program, we try really hard to provide discounts and or scholarships for those individuals that do not have an organization to cover them. So you can always contact me back channel if you would like more information. Let's see if we have any questions on this section before I turn it back over to Dr. Huffman. And if you have any follow-up questions, after you've taken a look at these websites or thought about this, shared it with your leadership, always feel free to reach out to either Ashley or myself. So I think we're going to go to FAQs now.
Be great. Brandy's going to pull that up from the website, and we'll talk through those. And you see how well this website is organized. It's, everything we're presenting today is just right there. So we work together, UTHSC, the 3 MCOs, to come up with what we anticipate to be some of the frequently asked questions, right? And came up with the best answers at this point. There are a couple of things that I'm going to highlight there, that we still have to work on. And so just start scanning through. So what services, you see the codes, we went through those, and you can hit that hyperlink and it just pops up the document, and then we already covered the next point. Will insurance companies accept these reimbursement codes? The answer is yes. Other health plans may adopt some of this. Again, we focused on Medicaid initially. So, that's the work of Blue Cross Blue Shield right now, is focused on this. That doesn't mean that in the future, or even now, it's not in play, but that wasn't our focus initially. We want to get Medicaid, nailed. Let's see. it has some questions about, can you bill more than one service on one claim? And the answers are there. I'm not going to give all the answers, just keep scrolling so you see what's there. You can always go back and look at these. Modifiers, yes. There's, place of service and telehealth modifiers, and they're named there. Susan just went through the health coach training certification standards document. So keep scrolling. So let's stop there. Will health coaches require credentialing and contracting? No. A health coach won't have to be credentialed or contracted with a health plan, because the structure is that a physician or other qualified provider will bill the service. Okay. Now, right now in the structure, we have, MDs, DOs, etc., nurse practitioners, and PAs. This is where I get into it, because we have another question about in the future about pharmacists. So Ashley and I have a meeting coming up, to kind of figure out what's going to be the path forward in Tennessee. CMS guidance around, and let me just share this concept. It's probably later in the FAQs, but so the structure of billing is by, certain providers and that are overseeing the work of health coaches. I'm just simplifying that. It's called Incident 2. So it's Incident 2 services provided by that licensed credential provider for all 3 MCOs, okay? That Incident 2 billing is a tricky little thing with TennCare. So one of the things I did recently is I went through all this again with some of our friends from TennCare and said, hey, you have to give each MCO approval for this Incident 2 billing. And so they did so. That was good. In that conversation, I brought up pharmacist, and CMS guidance is very confusing. And but I will tell you that inside Blue Cross, I'm not saying the other 2 MCs don't have this, or health plans, whatever, but we have some pharmacists immensely interested. And so we have a meeting coming up. Actually, I can't remember when it is, the next few days. And we're going to talk through this and figure out how do we, make it really clear, because there's a Tennessee law passed, in my CMS, my own Google search, searching the internet, all these websites. I'm like, oh, Tennessee said pharmacists are providers, right? And Ashley knows that. I'm like, well, my conversation with one of our pharmacists internally is like, yeah, but that law got passed, but we don't have all the structure and everything in place with the health plans and making sure TennCare understands it. So that's a next scope of work for us, and we're about to get started, okay, in the next few days. And we'll bring the other 2 MCOs into it and talk to TennCare about it. So that's where we are with pharmacists, either directly billing or overseeing, quote unquote, Incident 2 services by health coaches. We're going to get that worked out. We're not going to wait a long time. We're going to tackle that, get that figured out. So anyway, hope that's helpful. My own internal discussion yesterday, I'm like, hey, we need everybody that can help our members. We need this. We need the pharmacist, and there's some other structures now, the MTM program and things like that, but medication therapy management under TennCare. But, we need more. We got to figure it out. So that's my short diatribe about that. Okay, we keep rolling. So this is the second one is the remote patient management or monitoring services. So UTHSC has found someone a vendor, RPM vendor, available to practices. But that raised a lot of questions recently in one of our meetings that we have. We have quite a number of meetings over all this. And so that's the second thing to tackle is, okay, I know that BlueCare and I know that United Health Group have contracted vendors providing RPM. So it's like MCO initiated, connected to providers. One of the core pieces, I communicated this back to UTHSC team via email, including Dr. Bailey, is like, hey, yeah, we got to work this out. We don't need to be tripping over each other. And so we'll be tackling that one as well. So I don't want to say, you keep talking about where the water's muddy, but got to get that figured out. How can practices, get their patients hooked up for remote patient monitoring? And then what does that mean? So anyway, I'll stop talking there, but you get my drift. That's another thing we're in the process of tackling together. Okay. So, answer can one of these services on the same day, or so there's an answer there, right? And you'll also see refer to standard coding sources or appropriate modifier and procedure code standards. That seems like evasive, but 25 modifier, there you go. That's what you use, 59 on claims. And if none of this makes sense to you, again, we're available. The UTHSC team and the rest of us will try to get you the answers if we haven't given a specific enough answer. We tried to do well with this document, but we're open. So you got the combination of codes. You can read that. How will we audit to ensure basically, part of the best practice identified in the United States of America, including Tennessee, is there's documentation, electronic health record, so that should anyone need to audit, are these services being provided appropriately? It would be like that. So I hope that helps. Let's see. Reporting codes are submitted for informational purposes only, right? If there's no payment and the code is billed, it helps everybody understand what's going on. Pharmacists, I've already tackled that one. The next one is, do health coaches have to be part? We already said, okay. Ashley covered that. Sort of yes and no. Medicare, yes. TennCare, no. All right. You don't have to do it for TennCare. More information. This is a good one. It's like those network managers I was talking about. Each MCO has to have them available to you. So that's the other avenue for if things aren't working right, that's what they do. And I tell you, it really works because I get involved. It's a separate provider network management team for all of Blue Cross Blue Shield Tennessee. They also take care of everybody, whether they're taking care of Medicare or commercial or Medicaid members. And they'll give me a call or they'll ping me on some kind of chat or the chief medical officer. And we're like, oh, okay, well, what is it? And they're trying to figure out what it is, right? If I'm making any sense. I mean, what's the issue here? And we work to a resolution, we try. I'm sure I used to be a provider and it had a very dim view of health plans myself. But I can attest that we do take it seriously. We want to work, find those solutions for our providers. And sometimes we can't do everything a provider would like for us to do, but, we try and we do respond. So that's probably the end of it, as I recall, our FAQs document. So any questions for me? Well, I may have some questions for y'all if you don't have any questions for us, so you better.
I was gonna say while we wait on questions, I see that Dr. Butterworth has put her email in the chat as well. We've got Tawanda Murray said, all ears, good information, and Diane Sloan said, thank you. Does anyone else have any questions or comments maybe about how they see implementing this in their practice or workflows or anything like that?
Yeah, I would just be interested in hearing people's interest in attending the webinar and what you're thinking, what you're currently doing. it would be helpful to us just to kind of hear where you are on that continuum.
That was going to be my question, Susan. So y'all please share. I mean, just share your thoughts.
Can you hear me? This is Diane Sloan.
Yes, we can hear you.
Sorry. Okay, this is Diane from ETSU Health. And I'm just thinking this is all great information. We always are trying to map up what we actually do for our patients and how do we get reimbursed for things that we give value for. And so this is a great piece of information. I need to go back and do an inventory of who all has done the health coaching. I know that we've had a few in our ETSU family medicine practices, but my homework is to go back and see who actually did the training and then work with the medical directors on getting things implemented. Especially now that you've provided this great information on billing.
And Diane, if you want to reach out to me back channel, I can, from our dashboard, I can let you know who from ETSU has gone through the training and which parts.
Okay, great. Thank you, Susan.
Sure.
And thank you for asking the question. I just asked Susan that the other day. She sent me a list. I said, who's already done the training? I'm just trying to understand, you know, what the potential progress is going to be with this important initiative. Yeah.
Yes.
All right, Tawanda, you're getting started. You're ready to open the gate. Get after it. That's great. I don't jump on all meetings for UTHSC in all this work, but I'm very interested in the voice of the health coaches. I really want to know myself. I think everybody does, all the way up to the executive council that kind of oversees all this stuff. I think everybody wants to know what you're thinking, how it's going. Yeah. Just pepper us with information. Okay. Well, I just asked Ashley and Susan, y'all feel like we've done what we wanted to do today?
We've got a message from Amber.
Oh yeah, I see that. Thanks.
Yeah, she said, I would love to do the training and begin billing. I'm in a prime position. I have my own business and would like to get paid through that instead of working for the conglomerate here, but I don't know where to start.
Yeah, that's a great question. You know, I hear you. I'm kind of like a rebel by nature. They rehabilitated and put in a health plan. So, yeah, we're hearing you there. I don't know. Maybe I don't know how to answer that question.
There certainly are in the incident too. If you look at the definitions of it, there it does allow for the employee to be a W-2 employee, a 1099 employee, a contract employee. I mean, for instance, if you look at us in our faculty roles, we're employees of UT, but we have plenty of faculty members who work in health systems and are providing those roles. So there are certainly ways to do that and meet the requirements for this billing.
That's a great answer, Ashley. You know, I tell everybody all the time, Ashley and Susan and others know so much more than I do about some of this. So glad you had that answer.
I would it's Julia McKay.
Hey,
I'd like
Julia.
to see, I'd like to see more around that. And just, you know, just as being a nurse and being on the floor and the different roles that I've been in, I find that when you're trying to get a program like this started, incentivizing is one of the things that you need to really look at, because money does help drive people to and motivate them to work a little bit harder. So one thing I was thinking about is, you know, how can we say like base pay and incentivize if somebody's doing health coaching, because you could hire a health coach and say, you know, we've hired you as a health coach. They could talk to 2 people all day, you know, and you could have someone who's really, really driven and talks to tons and tons of people, same pay scale. So that's one thing that I was thinking about is how do you make this role one of those where, you know, the more they health coach, the more they get into it, the more they touch these people's lives and feel that they are actually get a percentage of that to help build their income and make it to where it's very valued that they work harder and touch more lives.
And Julia, I'll speak to this, having run a health coaching practice. It does take preparation ahead of time. It takes some very careful analysis from the clinic in terms of who's going to be the target population. How is the outreach going to happen? Are there going to be, you know, physician champions or pharmacist champions and warm handoffs? You know, how are you going to evaluate? I've always recommended that you start with your biggest pain points where you really can see a difference. And you can run a pilot program. But some of these are covered in our toolkit, our health coaching toolkit that we have on our website. And others are, you know, something that we'd be happy to talk to you about, you know, back channel to meet with your team. Because you're right. I mean, not just the financial situation, but all of that in terms of how is this health coach going to fit into, you know, how are they going to be integrated into that team-based care?
All right.
Yeah, and whatever, I mean, Julia McKay's voice popping up, it's my spirits just lifted. Julia knows what I mean by that. And so, yeah, I mean, as those conversations occur, though, let's be intentional about bringing those forward, you know, and sharing them. You know, Susan, thank you for that offer. You and Ashley, like I said, you're the real experts, rather than me and Julia. She's ascended the ranks. I had a chance to spend some time with her in between jobs at UT Family Practice Center 12 years ago. And, you know, it's been fun for me to see Julia go from what she's doing to what she's doing now. And so, yeah, I'd love to hear more about, you know, those conversations. I know everybody would, you know, as we go forward. And how can you really make this work? It kind of goes back, that's really a critical piece to that. It's like, hey, you can't pay somebody to see 2 patients a day, no matter what the code pays, right?
Right.
And so that's the real mechanics of this. And Susan, you have firsthand experience, I think, as that, and I know it's probably already on the toolkit or something, but proactively bringing that, I mean, all the way up to the executive council, the Heart Health Network. These are the real things here. We got to make sure the MCOs pay these things, and I think we got that covered. We got to figure out the RPM and pharmacist pieces, which are critical. But this real life, how do you make it work for your practice? We need to have more of that. It may be there, and I hadn't seen it, you know what I'm saying, but I think everybody's going to be really interested in that. How can you make this work for the patients, the staff, you know, of your clinic, your practice? You know, how can this really work?
And I'll give just a little plug. Next week, we are having a webinar in the evening about for clinics and practitioners about how do you integrate health coaches into your clinic. So look for that invite. And Ashley, I think there's a question posted that you might want to answer on the chat.
Yeah, looks like Arpana asked, for pharmacists, there are certain services that are considered not to be in scope of practice, to be delivered as counseling. So do you need to be a health coach, only medication counseling? How about motivational interviewing to be billed? Okay, let me think about that. I wouldn't say that anything we've put on that list would be outside of scope of practice. Everything on that list in our Pharmacy Practice Act in the state of Tennessee, we would be covered. I think what we're talking about is two different things as far as contracting and credentialing. As a pharmacist, you can do it, but we're talking about whether you'll be reimbursed for that. And then the motivational interviewing is the style in which you deliver it. So if you're interested in that, as far as the motivational interviewing certificate, we've had all different types of professionals go through that. Medicine, nursing, lay people go through that. So if you're interested in that, please let us know. I think referring to what Dr. Huffman said, we will have more guidance for pharmacist reimbursement coming soon. We're hoping here that we can announce that it's a little bit different because pharmacists in the state of Tennessee, including with Blue Cross Blue Shield, other lines of business, not just the Medicaid portion, are already receiving reimbursement for services in different ways, fee for service, as well as value-based contracting and credentialing. So we just want to make sure that everybody is paid for the work that they do. So I think you'll receive some more guidance for that soon. The other thing I was going to say is I put in the chat this link, the CMS MLN, the Medicare Learning Network, that really defines what Incident 2 is. And there's also different levels of supervision. So for instance, like remote patient monitoring or CCM, you could be providing those services and working remote because it just requires general supervision. So if you want to check that out and just read it for yourself about the different types of employees that people have, feel free to do that and let me know if you have questions. I think we've got just a couple more minutes. I wanted to just take a second and say thank you for joining us today as part of this learning collaborative. We have these scheduled throughout the months going out, through the year. We have 4 different tracks. We have team-based learning, the pharmacist physician collaborative, meeting social needs, and what's the other one, Susan? I'm missing it.
Community and patients.
Yes, there we go. Community and patients. And so some of those may appeal to you more than others. They will be announced in our newsletter and our social media. We would love for you to join those, share the listserv with other people. If you have people in your organization that you think would like to be added to our listserv, please let us know. If you have speakers you would like to hear from, if they're in the state of Tennessee or if they're national speakers, please let us know so that we can meet your needs as part of this. And we really appreciate you all joining us during this time. This is being recorded and will be posted as a webinar under the resources tab on our website. So please share it that way as well.
I would echo that. Thank you for joining today. This is just invaluable. The questions, the insights, it's really helpful for all of us as we're trying to move the program forward, shall we say.
Thank you, everyone. Have a great rest of the day.
See you all.
Thanks, everyone.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.